The proliferation of fake drugs in Nigeria has become a pressing concern, putting lives at risk and undermining the country's healthcare system. The issue of fake drugs in Nigeria is complex and multifaceted. While some Nigerians blame economic factors, others point to a lack of government oversight and public awareness. To combat these menace, a comprehensive approach is needed, involving stricter regulations, public education campaigns, and increased access to affordable, genuine medications. In getting public opinion on this critical issue, our correspondent took to the streets to gather views from some residents of Abuja.
Eliminating the menace of fake drugs in Nigeria is a challenging task, especially considering the economic struggles many citizens face. The prevalence of counterfeit medications is alarming, with estimates suggesting that up to 70% of drugs distributed in Nigeria are substandard or fake.
Fake drug is affecting the system negatively because most of the activities of those people buying fake drugs from unrecognized pharmacy. When you enter pharmacy to get the drugs, and if the National Council of Pharmaceutical Council of Nigeria did not approve a particular pharmacy, they give them the impetus to get their drugs from unidentified and unauthorized means. Well, most of the citizens are not well educated enough to read what is written on the what is written on the particular drug, whether it's the date have expired or not. It doesn't affect them. They just want to take drugs to make sure it cures their sicknesses. The implications are vast. Increase in the diseases.
Citizens' reactions to the issue are mixed, as some spoke on why a lot of individuals are a victim of unapproved local drugs.
Anything fake, is bad. So when we say fake drugs, it means that whenever a person take fake drugs, one, it kills the cells and it doesn't function in the body. Rather, it causes depreciation and other kinds of elements that depend on the cells, strength of the cells, and it depends on individual cells, because the cells in individual is differs.
Fake drugs, I think the major causes of the fake drugs is because it's cheaper, and second reason is lack of awareness. Most of the time, and another reason is self-medication. Most of the time, the common man believes that going to the hospital is expensive, and so he would just rather just go to the chemist and prescribe something for himself and just take something to probably cure, instead of doing a proper diagnosis of what is happening. So I think the leading cause of fake drugs is awareness, lack of awareness that our health should be taken so seriously, so importantly, so that they will know that no matter the cost of it, is somebody that is healthy is better than somebody that is dead. No matter how much you have saved up, you cannot spend it when you are dead. So I think we should be very aware of that. That's the leading cause. They should create awareness for people to know that your health is wealth. Health is very paramount and health is important.
Some emphasize that eradicating fake drugs requires a multifaceted approach and suggested that the federal government must deal with the issue from a global perspective, filtering and regulating the global supply chain of medical products.
I think what should be done is for the government to bring up tax force that will enforce such kind of things. They should go to all these kind of public sites.
If the government can come in by enforcing a law that is very, very firm, that is also like people who are not biased and also not does not collect bribes. Those, I think, it will help, like for them to go into the street. Most especially, I think most of these agencies, some of them have friends who also take it. The government also, there are some of them who also take the drugs also that are illicit, that are not good to health. And some of the people who manufacture these drugs are also part of the government. So we can't blame the masses at once, but also blame the government also, because the government need to put up an agency that will regulate every drug that goes in and out for human consumption.
Fake drugs often originate from foreign manufacturers, making it difficult to track and regulate their entry into Nigeria. Hence the need to strengthen NAFDAC's regulatory powers and increasing funding for the agency and collaborating with foreign governments and pharmaceutical companies to track and prevent the entry of fake drugs into Nigeria. Victoria Ayonude, reporting for KAFTAN TV.